Assalamu alaikum doctors, welcome to my YouTube channel MBBS and BDS lectures. Today is the 7th video of repeat revision course of endodontics, which is very important for NLE, MDS, NBG as well as for BDS students. In this video we will discuss about non-inflammatory pulp diseases like pulp necrosis, and second is the internal resorption. Now, first we start from pulp necrosis. In pulp necrosis, the main MCQ's point is that there will be discoloration of the tooth. Now, we will discuss about pulp necrosis, how pulp necrosis occur, its pathogenesis, clinical feature, histological feature, and its management. Now, pulp necrosis is the death of the pulp occur from long-term interruption of the blood supply to the pulp. Now, for example, untreated pulpitis such as caries exposed pulp or trauma to the tooth. Mean when there is trauma to the tooth or there is untreated pulpitis, in result there will be death of pulp. And why? Because due to long-term interruption of the blood supply. Due to long-term interruption of the blood supply, the pulp become dead. Now come to the pathogenesis. In pathogenesis, the inflammatory exudate compressed within a hard shell of dentine. Mean around the pulp there is a hard shell of dentine. When inflammation occur, there will be inflammatory exudate. This inflammatory exudate compressed because there is no expansion. Because around the pulp there is a hard shell of dentine, it leads to compression of blood vessel, particularly the apical blood vessel, which then leads to infection and necrosis. These compression of blood vessel affect blood supply. In result, there will be pulpal necrosis. Now come to the clinical picture. When we check patient clinically, necrosis is characterized by cessation of all symptoms. There will be no pain to the patient. All symptoms will be stopped. There will be no pain, no cold and hot sensation. Next, in clinical feature, there is a discoloration of tooth. Why discoloration of tooth? Look at diagram, the tooth will be discolored. Why? Due to affection of dentine by necrotic tissue or extravasated RBC in trauma cases. And these necrotic tissue and extravasated RBC cause discoloration of the tooth. They will be accommodated in dentinal tubule areas. Now, in clinically, there will be no response to pulp tester. When we do pulp test like electric pulp test, cold test, hot test, there will be no response because the pulp is dead. Now, in histological feature, there will be microscopic section show either an empty pulp chamber and canal or isolated area of necrotic masses. In treatment for pulp necrosis, there is a root canal treatment. Now come to the second is the internal resorption. From internal and external resorption, most of the MCQs was come in previous March and June attempts. Mainly they ask the cause of internal resorption and cause of external resorption. Now, the cause of internal resorption is the chronic pulpal condition, mean pulpal inside the pulp. But the cause of external resorption is the periodontium pathology. Now, in internal resorption, the MCQ's point, like in pulp necrosis, the MCQ's point is the discoloration of the tooth, because they give in NLE exam the clinical scenario. But in internal resorption, there is a pink to top memory. Now, in resorption is the loss of tooth structure from within the root canal. Mean the loss of tooth structure from within the root canal or the pulp chamber of the tooth. The loss of dentine create a large pulp space. There will be large pulp space which allow more blood vessel. In that large space there will be more blood vessel to fill the area. When more blood vessel accumulate in the area, in the result there will be pinkish hue or pinkish color of the tooth. Why? Due to more blood vessel in the that loss of dentine create space, and this tooth is known as pink tooth of memory. Look at the diagram. The tooth is looking pink due to internal resorption. Now come to the pathogenesis. In pathogenesis there is a chronic pulpal inflammation, mean inside pulp. The chronic pulpal inflammation is a cause of internal resorption. The pulp must be vital apical to the area of resorption to provide dentinoclast with nutrient. Typically the coronal pulp is necrotic with the apical portion remaining vital. Mean the apical portion is vital and the coronal pulp is necrotic. If the pulp become totally necrose, the resorption will stop because there will be no osteoclast. There will be no any nutrient per osteoclast. Now in clinical feature, there will be asymptomatic but may present initially as a pink hue area on the crown of the tooth, which is known as pink tooth of memory. It may present as an incidental on radiographic finding. If the process continues, the root surface may become perforated. Now in radiographic picture, this is very very important, the radiolucent balloon-like dilation of the canal. If there is a balloon-like dilation of the canal, this is a characteristics of internal resorption. In histological feature, the resorbed dentine is replaced by inflamed granulation tissue, mixed inflammatory cell infiltrate. In treatment and prognosis, if condition is discovered before perforation occur, root canal treatment has a fairly high success rate. Removing the inflamed pulp result in stopping of the resorptive process. Once perforation occur, therapy become more difficult and prognosis is poor. This is all about today non-inflammatory pulp disease, in which we discuss about pulpal necrosis in detail and internal resorption. In coming videos we will discuss about periapical pathologies. Now there are more than 530 videos present on my YouTube channel, and every subject repeat revision course is present in a sequence manner. You can watch all these videos, and if you like my video, press the like button and share this video with your friends. If you are new to my channel, subscribe my channel by pressing the red subscribe button, and also press the bell icon in order to receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.